Namaskaram ji. Welcome to this session on Breathworks. Season 1, Episode 3. Those who are well versed with the web series, they must be knowing what it means. In these sessions, we are basically touching on the basic practices or basic understanding of Breathworks. And today is the third session. I'm sure you must have attended the previous two sessions also. And by now, you must be having a lot of clarity about what is the physiologically most efficient form of breathing. What is diaphragmatic breathing? First, you need to have this understanding what is diaphragm, where is diaphragm, how to control the movement of the diaphragm. That means at will you should be able to move your diaphragm. You should be able to do abdominal breathing, in which predominantly the movement is because of the diaphragm, or the chest breathing, where you learn how to make the diaphragm almost still. It's not that it is not moving, but there is hardly any movement of the diaphragm when we are doing chest breathing. When we are doing abdominal breathing, there is mainly it is because of the movement of the diaphragm. We have already touched upon this aspect, how to diagnose that whether you are a chest breather or an abdominal breather. Second is, in the second session, we touched upon this aspect, various, in three postures, in which you can learn or you can do diaphragmatic breathing. Upright posture, on supine, that means you are lying on the back, and lying on the tummy, prone position. We call it a prone position. And out of these three, as we discussed last time, prone position is supposed to be the best one, because there is automatic fixing of the chest wall muscles. So the chest wall movement is minimized. That is one of the biggest advantage. Second is you can feel the movement of diaphragm as you keep deepening your awareness. You can feel the movement of diaphragm like this. Yes. Second difference, if you remember, we have talked about in supine position, when I'm lying down on my back, just like Shavasana, you can feel just one movement, moving up, moving down, the tummy going up with inhalation, tummy going down with exhalation. In upright position, you can appreciate two movements, because diaphragm is all around. It's just like a tent shaped. We have already discussed in detail about this in the second and first sessions. So when you are sitting upright, you can appreciate two movements. One is in the front, the navel area, the abdomen going out. Second is, see, inhalation, exhalation. You can appreciate this. In fact, this appreciation is better than the front one when you are sitting. Upright position. Sitting means upright position. It can be done standing also, or sitting position. Sitting, you can sit on the floor, Sukhasana, or on the chair, Maitriyasana. Both are equally effective. Third is in the prone position. You are lying down on the tummy. You can appreciate three movements. Sideways also, front one also, and the one at the back also. When you inhale, the back, it will rise upwards. And when you exhale, it falls back to its normal position. This movement you can appreciate. So you can appreciate three movements in prone position. So see, three things are happening. Three very important things are happening in learning diaphragmatic breathing in prone position. First one is you are fixing the chest wall muscles. You need not worry much about this movement. So mainly it is the diaphragmatic movement. Second, you can appreciate the diaphragmatic movement. See, what a beautiful posture to learn diaphragmatic breathing. And third is you can appreciate all the three movements in the front, in the sideways, at the back. So my request is, if you have been practicing, very good, then you have to deepen your practices. But if you have not been practicing on a regular basis, better to start with prone pose, being on the prone position. First, while sitting, understand what mechanism is happening, why the abdomen wall is moving out. It is because of the movement of the diaphragm, not because of the movement of the air going inside the abdomen. Lot of people think that abdominal breathing means you are putting air into the stomach or abdomen. No, air cannot go beyond the lungs. Physically, it cannot go beyond the lungs. As simple as that. So, it is because of the movement of the diaphragm that your abdominal wall moves out and comes back into the inner position. Simple. So, any queries, any questions from session 1 or session 2 before we proceed further? Because today we are going to learn. You can write down in the chat box, or you can come online and speak your question. Both are allowed. So let's see. In case you have got any queries, then I will try to answer those queries. And in case there are no queries, then we will proceed with the S1E3, Season 1, Episode 3. Any queries, any questions, you can write down in the chat box, or I will be able to see that. Or if you want to speak your question, you can speak. You can do that also. You can unmute yourself and speak your question. Because today we are going to, talk about the 5 good signs which your breath should be having. If those 5 good signs are not present, then you need to work on those signs, incorporate those signs in your breath so that you can maximize the benefits of your breathing.
Can I ask a question?
You have forgotten to use.
Dr. Bhatt, can I ask a question?
Go ahead, Sumedha.
Yeah, my question is, for asthmatic patients, what is the best position to sleep on?
Also, if you can switch on your video, that will be nice. But the choice is yours. Because when I see your faces, I do get motivated. That is also there.
Okay. Oh God,
so
I don't know where's my video.
Proceeding with, it seems as of now there are not many questions, no questions at all. So we will proceed with the.
No, I asked a question.
What we are going to learn today.
Dr. Bhatt, Sumedha has a question
about
on what position should she sleep if there's a person who's got asthma.
Signs of your breath. 5 विशेषताएं ये जरूर होनी चाहिए आपकी ब्रीदिंग में. अगर ये 5 विशेषताएं हैं, गुड साइंस हैं, तो आप मान लीजिए आपकी ब्रीदिंग इफेक्टिव ब्रीदिंग. this is in this modern age, for everything you require certification. For breathing also, whether you are doing it's a good breathing or not, you require this certificate. And this certificate has got 5 components. If you have got all the 5 components in your breath, then you can certify your breathing as good breath. I am having a good breath. आजकल है ना ISO होना चाहिए, ये होना चाहिए, ये सब सर्टिफिकेशन का जमाना है. We need to have the certification as far as our breath is also concerned. And this is, in fact, this is the most important certification which you can have in your life. If you are Okay. Okay. It seems there was a question. I don't know. Somehow I missed that question. Maybe I was too focused on my breath. So can you please repeat your question?
was a question by
So sir, I asked
Sumedha
a question.
asking whether in what position should a patient who's an asthmatic patient sleep?
I'm
Am I
unable to
correct?
hear that. I don't know why. Anyway, I think query was regarding the asthma. In asthma, what basically happens? Actually, I plan to touch upon the therapy part. Okay, in which position? In whichever position you are comfortable. There is no bar that you cannot sleep in this posture or that posture. No, there is no bar. As far as asthmatic sleeping for asthmatic patients is concerned. What is asthma? Asthma is basically there are inside the lungs there are various pipes, tubes and pipes. They are known as bronchioles. Basically, there is constriction of those bronchioles because of any reason. It can be allergic. It can be any some foreign element is there. It leads to spasm or contraction of the those pipes and tubes known as bronchioles, primary bronchioles, secondary bronchioles, tertiary bronchioles. So when they contract, you can inhale, but you find it very difficult to exhale. Especially the constriction of the pipe during exhalation leads to a lot of problem. That's why that sound comes, which is known as wheezing. Wheezing sound. We say, na, wheezing is there in your breath. Wheezing means when you are exhaling, when you are breathing out, that time the constriction in the pipe doesn't allow that free movement of the air to toxins to be thrown out. So this is one of the major problems with asthmatics. Request participants to post the questions on the chat. Okay. So this is one of the major problems. But in which position? Any position in which you are comfortable. There is no such thing that only prone you can lie down or only supine. No, whatever you are comfortable with. Usually, many of the patients are comfortable in supine position with slightly propped up. The upper part is slightly propped up. That they are comfortable with. Otherwise, as far as science is concerned, there is no bar that you cannot sleep on the prone position, you cannot lie down on your sides. No, you can. Whatever you are comfortable with. A lot of people have got this problem that if I sleep on the left side, my heart will get pressed. No, nothing happens. You have got a beautiful rib cage which doesn't allow anything to happen like this. So with asthmatics also, there is no bar as far as which position you should be sleeping. You can sleep in any position. In which position you are comfortable, that's all. Okay, we will talk about asthmatics maybe in one of the sessions exclusively or lung diseases. I plan to do that, but since this is a season one basic one, I want you to have that understanding. So how to take care of your exhalation, asthmatic, that really helps in asthma. How to stimulate your sympathetic stimulation, sympathetic nervous system, because that dilates the bronchioles. So you need to learn these 2-3 things if you're an asthmatic. Yes. So we are talking about 5 good signs of a breath. What are those 5? First one, sign number 1, it has to be nasal always. If you are a mouth breather, then you have to find out the cause, why you are unable to breathe through the nose. Always nasal breathing is the best, because the air which, there is air outside, it has to enter the lungs. So by the time it crosses the nasal passages, 2-3 things happen. One, the particulate matters, what particles matter or what pollutants which are present in the air, they are trapped by the nasal. There is a mechanism inside the nose. I don't want to go into too much medical science. But there are two mechanisms, beautiful mechanisms, which trap all the particulate matter which is present in the air. Second, by the time it reaches the lung, the temperature becomes at par with the body temperature. That is the beauty. That is the importance of nasal breathing. If you are not doing nasal breathing, if you are a mouth breather, then you have to find out, because you are, there is sudden gush of air inside the lungs with full of pollution or particulate matter, and the temperature of the air is also not at par with the body temperature. So which can be very dangerous for the lungs. It can cause injury to the lung. So nasal breathing is a must. We'll talk in detail about nasal breathing today. It's very important, In fact, if you see Google, a lot of people now, though I don't recommend that, mouth tapes, there are special tapes which have come, which you can, if you are, snorer, level 1 snoring, then they make sure that you tap your mouth and you breathe through your nose only. But I don't recommend that. Basically, you work on you do exercises, to activate the muscles around the windpipe, and you will be able to take care of the level 1 at least. Level 1. Division of septum and sinus make it difficult for some people. Request touch on that aspect. Definitely. So JP Singh ji, I will definitely touch upon that aspect also. So nasal breathing is a must. Number two sign, which you need to incorporate into your breath. That is, it has to be noiseless. You must have seen people doing a lot of, when doing pranayam. No, that is not recommended. If noise is coming out, not. There are few techniques in which you are supposed to have some noise. We are talking about normal day-to-day breathing. If it is noisy, then you need to find out why. That means there is some mechanical obstruction somewhere, or you are making too much effort to inhale or exhale the air out, because of which the speed of the air increases. It comes out or goes in with a speed. As a result, the sound is produced. Or there is some mechanical obstruction. It can be it can be deviated nasal septum, like Singh Saab said, or it can be, polyps, allergic polyps. Common. Any mechanical obstruction will definitely cause the noise. So you have to find out the cause. You have to talk to a doctor. If there is mechanical obstruction, then how to take care of that mechanical obstruction. If it is not there, then it should be noiseless. There should be no noise when you are breathing in. When I do my breathing exercise, there is no noise at all. Number 3, there should be no jerks anywhere in the breath. If there is jerkiness in your breath, झटके जिसको बोलते हैं, रुक के झटके के साथ आ रही है breath आपकी, तो there you have to find out. Most important cause is you are putting efforts beyond your respiratory strength of the respiratory muscles. That means you have to work on strengthening your respiratory muscles. Again, we will touch upon these all aspects in detail in each session. So you have to work on those muscles, to strengthen those muscles, so that there is no jerkiness in the breath. Jerkiness, why? What is the disadvantage of jerkiness of the breath? Jerkiness, that jerkiness is transmitted into the nervous system, which becomes ineffective. And nervous system is the mother of all the system. There should be no jerkiness at all. It has to be smooth and serene. Smooth and serene. Jerkiness means you are losing all the benefits. Even nasal benefit will not be much if it's a jerky breath. Because nervous system is the one which gets directly affected with jerkiness. So you have to work on that aspect. Don't lengthen it too much that it becomes jerky. Some people, in the name of making an effort, they keep on lengthening their inhalation and exhalation, but it becomes jerky. You have to take care of that. It should not become jerky. Jerkiness means the strengthening of the muscle is required as far as your respiratory system is concerned. Number 4, they are very important aspect. And remember, I am not talking about, there are certain techniques where you introduce jerkiness, where you introduce pauses also. I am not talking, when you are unaware of your breath, that should not be, it has to be nasal, it has to be noiseless, it has to be without any jerks. Number 4, no pauses anywhere in the breath cycle. Don't listen to anyone who says pauses are allowed. No. Again, if you are a practitioner of pranayama or breath work, you will say that we hold breath. That's a different thing. That is pauses with awareness. I'm not talking about that. I am talking about automaticity of the breath. Automaticity means when you are not aware of your breath, it should not have any pauses. If there are any pauses, be sure that you are soon going to suffer from some disease or you are already diseased. That's the surest sign of if there are pauses in your breath. There should be no pauses at all. In fact, one of the tradition from which I come, they compare pauses with the death. They say pauses are so bad. You have to work on your pauses. Eliminate those pauses. Consciously make an effort to eliminate those pauses. They should not be there. One pause is because of some problem in the brain. I'm not talking about that. I'm talking about normally in breathing. There should be no pauses at all. It has to be as soon as the inhalation finishes, exhalation starts. As soon as the exhalation finishes, inhalation starts. Something like this. रिले रेस होती है ना, जैसे एक बैटन का एक आपका रनर देता है, दूसरा एकदम से पकड़ लेता है. They don't stop in between. Something like this. So as soon as your inhalation finishes, start the exhalation. As soon as your exhalation finishes, start the inhalation. No pauses allowed. Consciously, no pauses allowed. So make an effort when you are doing any of the exercises. Don't add any pauses to start with. But again, I am repeating, when I am talking about these good signs, I am talking about automaticity of the breath. What is automaticity of the breath? When you are not aware of your breath, that time, it has to be nasal, it has to be noiseless, there should be no jerks, there should be no pauses. And fifth is most important. जो पांचवी विशेषता है, fifth good sign, that is the most important. What is that? Inhalation has to be equal to exhalation. Normally, in 90% of us, exhalation is shorter than inhalation. So we have to work on that aspect. Inhalation, when exhalation is shorter, that means you are not able to throw out the toxins. One, there are few toxins already present in the air, but there are a lot of chemical, hundreds of chemical reactions occurring inside the body, and toxins are being produced. So when we say this, then we are practicing holding breath is good. But before that, you should be able to achieve at least 6 breaths per minute. That is 5 minutes, 5 seconds inhalation, 5 seconds exhalation. If you are unable to do that, then there is no point in holding your breath. Lot of these days I have seen right in day one, people start holding the breath. They start teaching. No, first you have to learn, know the techniques. First you have to find out whether your muscles have adequate strength or not. Holding of breath or suspension of breath, what is known as suspension of breath in yogic sciences, has got very important, very specific purpose. Of course, it is good. But then it is good in a specific relationship. Right from day one, you cannot hold your breath. That is not recommended at all. Second is, once you have eliminated the pauses, then only you are eligible to hold your breath. Is your breath pause free? Is your breath noiseless? Is your breath without any jerks? Is your exhalation same length as inhalation? Then only you are eligible. Otherwise, you are not eligible. You can go into for graduation only once you have done 10+2. Problem with most of us is we want to do graduation right without going into the curriculum of 10+2. So you are not eligible to hold your breath till you have incorporated these five good signs. Unfortunately, people are not willing to listen to this. So they are not getting benefited from holding of the breath, suspension of the breath. I can vouch this from my personal example. I have seen this. It takes time. Don't think it is going to happen in a week's time. No. Always I say, if you start incorporating these five good signs in your breath today, 1 month for 1 decade. If you are 50-year-old, then 5 months are required. After 5 months, you will come to know that, oh, what the treasure was which we have been missing. But you start getting benefits within, say, 2 to 3 weeks. I'm not saying you have to wait for. You will get hooked on to. First 3 weeks, you have to discipline your mind. Again, discipline and motivation. You will be, when you are motivated, you do not require any discipline because you are passionate about the thing. But that happens very rarely. So you have to be disciplined. I will do this. I will incorporate consciously these things. Once you start incorporating these five good signs consciously, then after 3 weeks you will find that there is a lot of change in your breath. Your health getting upgraded. Your sleep, your emotions, your thoughts, everything is changing. So you have to form a groove with all these five good signs. Once you have formed this groove, then automaticity of the breath will have all these five good signs. That's a must. I don't teach anyone holding of breath until unless they have learned all these arts. So holding of breath is good, but until unless your basics are clear, until unless you have cleared the intermediate or 10+2, then only you are. It's a graduation, part of the graduation. So these five good signs, remember: nasal, noiseless, no jerks, no pauses, and then I-E ratio, inhalation, exhalation, श्वास प्रश्वास, सांस लेना और सांस छोड़ना, they have to be equal. 90% of us have got shorter exhalation. You go to a doctor for, he will say, take deep breath. Deep breath means focus only on inhalation, no exhalation. That is one of the basic difference between medical science and yogic science. Medical science says exhalation is passive. Yogic science says add awareness into your exhalation, make it, active. You learn the art of adding awareness into your exhalation. See the difference. Yes, any queries regarding these five signs? Singh Saab, as far as these days we are focusing only on the, let's see. We are focusing on the basics. So we are not touching upon a specific aspect. Today we are going to touch upon asthma. Today we are going to touch upon heart diseases. No, it's a general. And these basic things, if we incorporate, I am very sure in 80% of the diseases, they are going to help you out. I am very sure, I can vouch for this. If you just Do these 5 good signs. If you do diaphragmatic breathing with these 5 good signs, see the tremendous change in your lifestyle. Your sleep will go to a different level. You will sleep deeply. When you get up in the morning, you are totally fresh. We have to do this. So we will talk upon those, and let's see if there are any other. Stilling breathing through meditation should be done for long duration practice, different from holding breath. Yes, definitely. Bhanuji, definitely. So, stilling breath is, that is, there are two varieties of, you can hold your breath. One is with effort, one is without effort. Sahaj kumbhak, apne aap lag jata hai. You don't have to make an effort. That is meditation actually. सहज कुंभक होना चाहिए. मेरे in my tradition, from which tradition I belong, they don't teach kumbhak at all. They just focus on सहज कुंभक. सहज कुंभक क्या है? माइंड प्यूरिफाई हुआ, आपका माइंड वन पॉइंटेड हुआ, सहज कुंभक हो गया. आपको पता ही नहीं लगेगा, मिनटों तक आपका कुंभक लग जाता है. You don't have to time your kumbhak like this. No, we are not focusing on Hatha yoga. We are focusing on Raj yoga. So as your mind clear becomes more and more clear, जितने कम thoughts होंगे, जितने आपका clarity आएगी mind में, जितनी purified होगा आपका mind, your breathing automatically falls into these 5 good signs. Automatically, you don't have to make an effort. But very difficult to work on mind. And mind is directly related to breath. That's why we are focusing on breath. Focus on your breath, your mind automatically starts following this. They are very good friends, breath and mind. Your breath is erratic, jerky. Your mind becomes jerky. Number of thoughts increases. Hundreds of thoughts will cross your mind. Make your mind calm, your breath will become calm. But very difficult to make your mind calm. Calm your breath, make it smooth, serene, with 5 good signs. Your mind will automatically become calm, clear. Clarity of. That's the beauty. So Bhanuji, yes, stilling of mind is different thing. It's again graduation, post-graduation. I am focusing on 10+2. What about inhalation to the count of 4, exhalation to the count of 4? That's very good. See, again, basic is 1:1 breathing. A lot of people ask me, what should be the ratio between the inhalation and exhalation? Mr. JP Singh, this is for you. Inhalation. Inhalation 2:1. 2:1 means length of inhalation is twice the length of exhalation. When you are tired, physically tired, you had a tired day, you require a lot of oxygen, your body requires. So you do 2:1 breathing. Inhalation is twice the length of exhalation. Make it 8-4. 8 seconds inhalation, 4 seconds. I'm just telling you, it can be anything. It can be 4 seconds inhalation, 2 seconds exhalation. If you are tired, if you are anxious, lot of thoughts are crossing your mind, you want to make your mind have clarity, you want to calm down, you want to feel the quietness, then make it 1:1. A beautiful book has come, that is stress relief. Doctor has written, very old book, written about 30-40 years. 1:1, and now a lot of the theories a lot of research has been done on this aspect. 1:1 breathing is the best for stress management. Inhalation, exhalation. Samavritti pranayam. This is known as samavritti. What is samavritti? Same length inhalation, same length exhalation. 2 seconds inhalation, 2 seconds exhalation. 2 seconds inhalation, 2 seconds exhalation. And if you want to have one-pointed mind, want to go deeper into spiritual journey, want to have that achieve pratyahar, what is known as pratyahar, control of the senses, then 1:2 is required. 1:2 is exhalation is twice the length of inhalation. You have to focus on exhalation. We'll talk about this aspect maybe next time, how to lengthen your exhalation. So these are different ratios. These days you must have seen. So this is the importance. Basically, exhalation should be at least 1:1 ratio. That means length of exhalation should be, inhalation should be equal, length of exhalation should be equal to length of inhalation. You have to focus on that. Once you are comfortable, then you can lengthen it. Maybe 4 seconds inhalation, 6 seconds exhalation. That is good. Rather than going directly into 1:2 breathing. 1:2 breathing is, exhalation is twice the length of inhalation. You slowly increase the ratio, 1:1.25. Then make it 1:1.5. Then make it 1:2. So slowly you increase your ratio rather than going into one go. My query was on the context of the equal inclusion issue. You should inhale and exhale noiselessly. Absolutely. It has to be noiseless. If it is not noiseless, that means you are, one, you are making more effort. Second, your muscle strength, muscles which are used in, one is there is some type of obstruction, mechanical obstruction, if there is noise. Second is, you are making too much effort, you are putting too much effort while inhaling and exhaling. Because of that, lot of air being sucked in with lot of speed, that is causing the noise. That is also not recommended. When that is there, the nervous system becomes jerky. So it has to be noiseless. Unfortunately, if you go to the park, lot of people are doing pranayam with exercise. You will come to know, 1 किलोमीटर दूर से पता लगा था ये बंदा नाड़ी शोधन कर रहा है. Not recommended. You will not get benefit. इनसे पूछ लीजिए क्या बेनिफिट हुआ आपको. वो हमेशा यही बोलेंगे कि कोई बेनिफिट नहीं हुआ, मैं 30 साल से कर रहा हूँ, उतनी ही बीमारियां हैं मेरी. होंगी, क्यों नहीं होंगी? आपने फॉलो ही नहीं किया डिक्टम जो होना चाहिए, बेसिक फाउंडेशन. यू हैव टू वर्क ऑन योर फाउंडेशन. आपको 3 बिल्डिंग फ्लोर बनाना है, फाउंडेशन स्ट्रॉन्ग बनाएंगे ना. फाउंडेशन आपका स्ट्रॉन्ग नहीं है, बिल्डिंग बना लीजिए, किसी दिन ढह जाएगी, आपको पता ही नहीं चलेगा. आप कहोगे आई हैव बीन प्रैक्टिसिंग प्राणायाम फॉर लास्ट एजेस, सो 10 years 20 years ये मेरे को मिला है. That is one of the reasons, because your foundation is weak. Work on your foundation. What is the foundation? Diaphragmatic breathing with 5 good breaths. नहीं है तो कुछ नहीं होने वाला. आप कितने भी साल लगा लीजिए, ये कितने कर लीजिए. You have to have this clarity. Do not hold our breath while we inhale. Anulom vilom, just yes. Initially, I don't recommend it. Inhale, you should not be holding while doing नाड़ी शोधन या अनुलोम विलोम, वो भी अलग अलग है, लेकिन अभी उसमें डीपर में नहीं जाएंगे. आपको होल्ड नहीं करना चाहिए, उसको लेंथन करिए ना. 1:1 का, इफ यू आर कंफर्टेबल, 4 inhalation 4 exhalation, good. Then make it 5:5, make it 6:6. It's better to make it 1:1 ratio with length, increase length करिए. इतनी लेंथ कर लीजिए, 10 सेकंड इनहेलेशन 10 सेकंड एक्सहेलेशन. क्यों नहीं हो सकता? हो सकता है विद प्रैक्टिस. आपके कितनी ब्रेथ हो जाएंगी? 3 ब्रेथ लेंगे आप सिर्फ 1 मिनट में. अगर आप इनहेलेशन 10 सेकंड, एक्सहेलेशन 10 सेकंड, इनहेलेशन 10 सेकंड. इट हैज टू बी लाइक दिस. यू डोंट ऐड एनी पॉजेस. पॉजेस का कोई इंपॉर्टेंस नहीं है शुरू में. आपके फाउंडेशन, आप अगर लेंथन करेंगे इनहेलेशन एक्सहेलेशन और 1:1 का रेशियो रखेंगे, ट्रेमेंडस बेनिफिट. आपको डे 8 से आप कहेंगे बेनिफिट होने लग गए. 1 महीना लगेगा पूरे बेनिफिट्स आपको पता लगेगा, लेकिन पता लगना शुरू हो जाएगा. We should not hold our breath while, yes, absolutely, very useful, thanks. 2 breaths a minute will be great. सर बिल्कुल क्लियर है, जितनी आपके रेस्पिरेटरी रेट कम होगा उतना आपको बेनिफिट मिलेगा. रेस्पिरेटरी रेट कम डायफ्रामेटिक ब्रीदिंग से होगा, रेस्पिरेटरी रेट 5 गुड क्वालिटी से होगा. यू हैव टू वर्क ऑन दीज थिंग्स. सीधा सा बात है, रेस्पिरेटरी रेट डिसाइड्स द नंबर ऑफ थॉट्स क्रॉसिंग योर माइंड. इफ यू रिमेंबर द very first session we had, रेस्पिरेटरी रेट डिसाइड्स द नंबर ऑफ थॉट्स. अगर आपको मेंटल क्लियरिटी लानी है तो रेस्पिरेटरी रेट कम करना है. कितना कम करना है? 10 या 10 से कम होना चाहिए. नॉर्मली कितना होता है? 14 से 16. नॉर्मल वी ऑल आर ब्रीदिंग एट अ स्पीड ऑफ 14 to 16. इफ व्हेन वी आर स्ट्रेस्ड इट गो टू 18, 20, 22, 24. गुस्सा करके देखिए, आप घर में जब गुस्सा आता है तब देखिए आपकी ब्रेथ क्या होगी. आप मजा आ जाएगा आपको. आपका रेस्पिरेटरी रेट हे वायर हो जाएगा, जर्किनेस आ जाएगी ब्रेथ में. आप उसको उसी वक्त जर्किनेस को हटा दीजिए, ब्रेथ को स्मूथ कर दीजिए, आपका गुस्सा शांत होने लगेगा. आपको दर्द हो रहा है, Focus on your breath. Lengthen your inhalation, exhalation with 1:1 ratio. आपका पेन आपको कम, यू विल बी, पेन कम नहीं होगा, बट आपको क्लियरिटी, आपका क्या है, इमोशंस कंट्रोल में आते हैं, प्लेजर पेन सब कंट्रोल में आना चाहिए, यू कैन फेस इट मोर इफेक्टिवली. अरे भाई कट जो लगेगा वो तो उतना ही पेनफुल होगा, आपको नहीं लगेगा. आप देख लीजिए, आप डॉक्टर के पास जाइए इंजेक्शन के लिए, क्या बोलता है? लंबी सांस लीजिए, यही मतलब होता है. कई बार डॉक्टरों को भी नहीं पता होता अनफॉर्चुनेटली. लंबी सांस में डायफ्रामेटिक ब्रीदिंग 1:1, you will find. And if you can lengthen your exhalation, nothing like that. People who have got longer exhalation, their health is at a different level, totally different, stress free, they are very healthy. So you have to work on your exhalation, but at the same time you have to increase your length of inhalation also. So make sure the foundation is very much there. Diaphragmatic breathing, nasal, noiseless, no pauses, no jerks, 1:1 ratio. सर गुस्सा तो सभी को आता है सर, आपकी वाइफ के सभी को गुस्सा आता है सर, किसको नहीं आता गुस्सा? बट इफ यू कैन जस्ट, दे हैव, गुस्सा इज नॉट बैड एज सच, बट गुस्से में खुद को जलाना बैड है. गुस्सा तो करना ही पड़ता है आजकल की लाइफ में, गुस्से के बिना कैसे काम चलेगा? But then you should not get affected. Usually what happens, if I am angry with you because of some reason, I vent out my anger, what happens? I keep thinking about that anger for 24 hours, 1 week, एक वीक सोचता रहूंगा उसने ऐसा क्यों किया, उसने ऐसा. ये प्रॉब्लम है. आप गुस्सा करके भूल जाइए, ये नहीं होता ना. ये तभी होगा जब आपके ये ब्रीदिंग होगी 1:1 फाउंडेशन. Yes sir, any more questions? ब्रीदिंग एक्सरसाइजेस फॉर पॉल्यूशन डू इनसाइड, या नेचर में अर्ली मॉर्निंग इसीलिए करिए, कुछ कर नहीं सकते. नेजल ब्रीदिंग इज द बेस्ट थिंग. इफ यू कैन डू नेजल ब्रीदिंग, इट विल ऑटोमेटिकली, इट बहुत जबरदस्त, बेस्ट फिल्टर मैकेनिज्म गिवन टू अस बाय डिविनिटी. नेजल ब्रीदिंग, नेजल ब्रीदिंग. सीलिया हेयर लाइक स्ट्रक्चर्स होते हैं अंदर, एक आपके स्टिकी मटेरियल होता है, म्यूकस. इट ब्लॉक्स ऑलमोस्ट ऑल द पार्टिकुलेट मैटर्स. दैट इज इंपॉर्टेंट. और लंग्स की थोड़ा हेल्थ बढ़ाता है. पॉल्यूशन से तो अब इजाद पाना मुश्किल है, इस जन्म में नहीं पा पाएंगे, लेकिन आपको यह है कि यू हैव टू increase the health of your lungs so that you can fight with that pollution. It's very difficult. I cannot suggest any of the methods कि pollution ठीक कर. Pollution तो गवर्नमेंट ही ठीक कर सकती है, हम नहीं कर सकते. हम अपनी हेल्थ ठीक कर सकते हैं so that we are able to, if even when the AQI is high, we are able to feel a bit healthy. That is what we can do. Right sir? Thank you very much. आपको 2-3 चीजें मैंने शेयर करनी है आपके साथ. एक तो प्लीज अपने फ्रेंड्स को बोलिए, सब लोगों को बोलिए आए, they will definitely get benefit. Second, I am available for consultation from Monday to Saturday at the same place where Venu Institute is there. VIILM. I am part of the Venu Institute of Integrative and Lifestyle Medicine. Do come, do drop in. We can have a chit chat. We can talk. We can refine your ways. So I am available for consultation from 10 to 1, Monday to Saturday. Second is we plan to start one more online session from first and second Saturdays, third Saturday, first and third Saturday. That will be for half an hour. It will be focusing on various important aspects. Next Saturday we plan to focus on lifestyle medicine. हमारी बहुत वेल नोन कंसल्टेंट डॉक्टर चित्रा सेठिया, शी विल बी देयर फॉर हाफ एन आवर. इट विल बी दिस हाफ एन आवर सेशन from 4 to 4:30. So please do join in. We will keep informing you about further development. And breathing affects heartbeat, definitely. It does affect heartbeat. It does affect. अगर आपके ब्रीदिंग कम, HRV हम बोलते हैं, हार्ट रेट वेरिएबिलिटी, इस पे हम डिफरेंट बात करेंगे, बट डेफिनेटली अगर आपके ब्रीदिंग जितनी स्लो करेंगे, आपका हार्ट बीट कम हो जाता है बिल्कुल. अगर आपका 90 है तो 80 हो जाएगा. आप ये डायफ्रामेटिक ब्रीदिंग विद 5 गुड साइंस करिए, स्पेशली इफ योर रेस्पिरेटरी रेट इज लेस देन 10, इट विल 100% it will start coming down, because it decreases the workload on the heart, it decreases the workload on the lungs, both. तो दोनों के लिए ही अच्छा है ब्रीदिंग में. थैंक यू वेरी मच, ग्रेटफुल. सी यू नेक्स्ट सैटरडे.